And welcome to Local Doctors on Call. Tonight we have with us Dr. Brian Foster from the Eye Associates to talk to us tonight about some great new technology for glaucoma patients with cataracts. Dr. Foster is a board-certified ophthalmologist, a bladeless laser cataract surgeon, and a fellowship-trained corneal specialist that sees patients in Sarasota, Bradenton, Ellington, and Sun City Center. Welcome. You are a very busy guy, Dr. Foster.
Thank you.
And also with us tonight is one of Dr. Foster's recent surgery patients, Dennis Willett. Did I say that right?
Correct.
Oh, good.
Correct.
Okay. To talk about his cataract surgery experience. And welcome, Dennis. We're so glad that you're with us as well.
I'm glad to be here.
Well, good. Well, Dr. Foster, let's start with you. And if you can first explain to our audience exactly what is glaucoma.
Yeah, glaucoma is an eye disease that everyone's heard that name, but a lot of people don't know what it is. And basically what it is the pressure inside the eye is too high for the optic nerve to tolerate. And over the years, that pressure takes a toll. It can cause nerve damage, and as the optic nerve is damaged, you can actually lose vision. The tricky thing and the difficult thing with glaucoma is that early glaucoma is completely painless, and a lot of times you don't even know there's anything wrong. So you can start getting a progressive peripheral vision loss that you wouldn't even know it's there unless we test for it.
And is that why it's called the silent thief of sight?
That's exactly right. It's painless, in some ways similar to high blood pressure. A lot of times your blood pressure is high for years, and if you never go to the doctor, you'd never know there was a problem. So the same thing with glaucoma. You can have pretty severe glaucoma. If you've never had an eye exam or don't get your pressure checked, you wouldn't know you have it.
And so if somebody is walking around and all of a sudden the peripheral vision starts to change, then that's, I mean, they're supposed to have an eye exam every year, I understand. So, and so that would help take away some of those consequences for people with glaucoma.
Exactly. The beautiful thing about our glaucoma treatments today is that we can often prevent progression of visual loss due to glaucoma. And we showed the graphic on the screen. Basically, it starts out as a very peripheral vision loss, and it works its way toward the center. But it's a sad day in the clinic when I see someone that's never had an eye exam and they're coming in with loss of vision, and we see them and their nerve is severely damaged due to the glaucoma. Once you have the damage, it's hard or impossible to reverse it. So the goal is to lower pressure and keep it under control to prevent progression over time.
Interesting. And if you have a question of Dr. Foster and you would like to call us, this is a live call-in show. We would love to hear from you. Dr. Foster would be happy to answer your questions, and the number is 361-4675. So give us a call and you can ask Dr. Foster your questions about glaucoma or any eye conditions that you might want to know about. And so are there different types of glaucoma that we should know about?
There are. The most common type of glaucoma is open-angle glaucoma. And that's the type that Dennis had, and that's the kind that we're treating most often. It's associated with age, as when we're like a lot of things, unfortunately.
Yes, I hear that a lot. Everything that we talk about is because you're getting older, Wendy.
Yeah, no, I know. But actually, not always. The kids can get glaucoma.
Oh, really?
And even some celebrities like, Ray Charles, he had congenital glaucoma, and so you can even get it as a newborn. So,
and that's why Ray Charles was blind, was from glaucoma?
I believe so, yep.
Wow, I didn't know that. And so how is it best treated?
So the mainstay of treatment is either laser or eye drops. And if we make a diagnosis in the clinic and a patient does not have any cataracts, then that's usually what we'll do. We'll recommend a painless laser procedure called SLT, or we'll recommend eye drops. And the goal of all of these treatments is to lower your eye pressure. Usually we're looking for about a 20 to 30% pressure reduction from where you are normally, but it varies based on how bad the glaucoma is. And so some of our recommendations change based on how bad it is, but that's a general rule of thumb.
And do eye drops work really well?
Eye drops do work well. The problem with eye drops are several. One is cost, because it's not a cure, it's an ongoing treatment, and you have to take your drops every day for them to work. So it can be a real challenge over the years to get these drops in and day out. You know, going to the pharmacy every month, paying co-pays and all that, it can get frustrating for my patients to do that. And so that a lot of times we're looking at other ways to treat it aside from just eye drops. Some of the eye drops have side effects, and they can be expensive. They can cause a red eye. They can cause some other problems. So we're always looking at other safe surgical options too to eliminate the problem or reduce the risk of progression that doesn't involve doing an eye drop every day.
Interesting. Well, if you'd like to ask Dr. Foster a question, the number is 361-4675. 361-4675. And so, Dennis, so I hear that you had a cataract as well as glaucoma. And how long did you have glaucoma?
I've had it for about 20 to 25 years. I lost track until I talked to my daughter the other day, and she said, "Dad, you had it when I was in high school."
And how did you know that you had glaucoma?
Well, through a regular eye checkup for glasses, you know, and then the doctor said, "Well, your pressure's a little high. I'm going to send you to a specialist," you know. And then they determined I had glaucoma. So I've been on drops for about 20 years, 25 years, and it's, as Dr. Foster said, it scared me, and I figured if I had to take them twice a day, once in the morning, once at night, and if I forgot them, what's going to happen? You know, he explained one time what happens, and it scared the heck out of me. So I tried to make sure I took them, but you had to put the bottle in a certain way so I'd remember I already took them. And then you go on vacation, you get sidetracked, you forget them, and it bothers you that the fact that I missed one drop, what's happening to my eyes. So the surgery I've had has made me feel a lot better. I mean, I don't have to worry about that anymore because I kept worrying about losing my vision.
And did you lose any of your peripheral
No,
vision at all?
no. Not that I know of, because I think Dr. Foster would have told me, but
Yeah.
I
He's been
don't
really
see
fortunate.
nothing.
Yeah.
You know.
And so what happens if somebody forgets to use the drops? Like if you missed a drop in the morning if he forgot, or...
Well, my typical question is, in the past week, how many drops have you missed? Because that, I mean, a lot of patients, just like when you go to the dentist, you floss really good the night before. All my patients take their drops before they see me. But realistically, everyone's busy, and I want to know, just be honest with me, on average, how often do you miss in a week? And if I'm determining that it's a lot, or it's more than a few, I worry, and we may need to change gears, look at laser or some other way to lower the pressure that's not dependent on you remembering day in and day out.
And those are just the drops that they've told you that
Yeah.
they forgot.
Yeah, exactly.
Interesting. Well, my mother, she used to tell me, if you have to take a pill every single day, in the night or the evening, do it when you brush your teeth, so that you always have it right there next to your toothbrush.
Yeah.
And so I've done that when I've had to take medication. So I thought that was a really good way to,
It is.
to remember. And the number again is 361-4675. 361-4675. And so, Dennis, since glaucoma has a hereditary component, did you have a family member with glaucoma?
Yeah, my brother and my dad were both diagnosed with it after I was. And my dad's passed away, so he was treated. But my brother never went in for checkups, and now he lost partially in his vision in his left eye. So if he would have had it taken care of, he'd have been all right. But he just kept one of those guys that never go get any checkups or nothing, And when he finally did, it was too late. He's lost part of his vision, so it's
so
scary.
Yes,
Because
it
you
is
don't,
scary.
like Dr. Foster said, you don't know what's gone. It just starts going little, and
I
all of a
guess it's
sudden.
because it's so gradual, so it makes
Yeah.
people don't realize they're supposed to be seeing big.
The human brain is very smart, and it's very adaptable. And so when you have a progressive condition like cataract or glaucoma, you get used to declining vision over the years. And the brain is also smart. When you have a loss of peripheral vision in one eye, the brain actually fills in the visual information from the other eye, so you don't even really know it's missing unless you for some reason close one eye and realize, wait a second, I'm not seeing in the periphery like I should be. So every once in a while I'll have a patient that catches it like that and comes in, but a lot of times the only way to catch it is with our testing that we do in the clinic.
Yeah, I think that's sort of similar to when the TV keeps getting louder, and you're not
Yep.
realizing that you're not hearing very well.
Yeah.
And also that you are losing your regular sight as you are getting older, trying
Yeah.
to see things close up. So if you'd like to give us a call, the number is 361-4675. Give us a call, and we're going to take a break right now. We'll be right back. And welcome back to Local Doctors on Call. I'm Wendy Mann-Resnick, and I'm here with Dr. Brian Foster and one of his patients, Dennis Willett. And we're talking about glaucoma and cataracts and some of the newest things that are going on with those new technologies. So if you'd like to ask a question, give us a call. It's 361-4675. And so, Dr. Foster, why did you think that combining glaucoma treatment during cataract surgery was a good choice for Dennis? That sounds like a lot of stuff.
Well, the beauty of these procedures is they are very quick. Cataract surgery takes typically 6 to 8 minutes, and combining it with these other glaucoma procedures adds just a few minutes. So it's very safe, and it's just an extra way to benefit him in terms of reducing dependence on eye drops, and just making sure, like he said, if he misses a drop or anything like that, that he's going to be protected. So the procedures we did were bladeless laser cataract surgery, because that was something that was affecting his vision. So we corrected that. We corrected his astigmatism, so he's seeing very well without glasses for distance. We did 2 glaucoma procedures. One is called ECP, and it's amazing technology. It's basically a little fiber optic camera that you can actually put within the eye, and there's a laser that treats some of the tissue that produces fluid within the eye. So I like the kitchen sink analogy. With glaucoma, you have a faucet and a drain. With that procedure, I turned down the faucet. And then the other procedure we did was called the Ice Stent, and that's a very recent development. It was FDA approved just a couple years ago, and it's basically a way to increase the drain. It's a tiny titanium implant device, and it's literally 1 millimeter long, and so.
And
Yeah.
how do you even with your do you do this with your fingers, or is this robotic? Or
It's preloaded onto an inserter, but it is microscopic surgery, which we do all the time. But it is very fine, very fine. So we actually have a little video I'm going to show you. This is the Ice Stent. It's actually called a snorkel, but what it is, it's basically a fluid bypass. And this little titanium device is implanted into the meshwork, which is basically the internal drain of the eye, just at the periphery of the iris here. And we put this device in the meshwork, and it is designed to go in, and it stays there, and we just make sure it's secure. That's a little movement there. But once that device is in place, it's perfectly safe, and it increases the fluid outflow of the eye to lower eye pressure. So that little cycle there is the fluid drainage of the eye, and you can see that as that fluid enters the eye stent, it more easily passes into the venous drainage and goes to the back to the rest of the circulation. But it's a new device, and it's a wonderful tool that we have in our toolbox to treat patients with glaucoma.
Okay, well, we have a caller. Dave, you're on live with Dr. Foster. What is your question?
Yeah, now that the state of Florida is looking at legalizing medical marijuana in the state, I'd like to get your opinion on how you feel about marijuana as a treatment for glaucoma.
Well, that's a great question. The interesting thing about marijuana is that there is some in vivo efficacy in lowering eye pressure, but one of my glaucoma professors during my residency, that was the favorite question we like to ask him. But the problem is with marijuana, it's really not a very good glaucoma drug. All of the other FDA-approved drugs that we have available are much more effective, much more long-acting in lowering eye pressure than marijuana. and even some of these surgeries that we're talking about are even more effective than the drops because you don't have to keep taking them over and over and over. So, and I've talked to several glaucoma specialists about this topic, and the consensus that I found is basically it's an interesting curiosity, but it's not going to be a recommended glaucoma treatment for lowering pressure just because it's not that effective.
Thank you.
Sure.
Thanks so much for calling in, Dave. And if you have a question, the number is 361-4675. And so let me ask you a question. Is there a way to prevent glaucoma?
Prevention is something that at this point we don't really have anything available. The main prevention that I recommend is surveillance, which is getting your eyes checked, and if there's any sign of glaucoma, I want to know about it. And even if we're not starting treatment, I want to watch the nerve over time just to see if there's any sign of a rising pressure or any progressive thinning of the nerve, and that can be an indication that we have to start treatment to prevent vision loss. So prevention is key, and the surveillance with eye exams.
Okay, well, we have Shane on the phone. Shane, you're on live with Dr. Foster. What is your question?
Hi, Wendy. I used to be your tennis partner at Country Club of Sarasota.
Hi there.
And you're a tough girl on the court. But I wanted to ask the doctor, y'all are really doing service to the community. It's wonderful. But can a cataract, excuse me, I'm sorry. Did you say something that I couldn't understand?
No, go ahead and ask your question.
Okay, thank you. Can a cataract that transgresses into glaucoma because I can't talk because I'm so excited to be on TV. Can it become from an injury?
Yep, that's a great question. There is traumatic glaucoma and there are traumatic cataracts, and that's something that in bad injuries we can see, and sometimes they can be very concerning and require surgery. Traumatic cataracts in particular are quite common after significant injury. They can develop pretty quickly. The same with glaucoma. That's one of the main reasons for close follow-up after an injury. And anybody that's had any type of injury that's concerned, if you've had any vision loss or any pain or anything, we like to take a look because the eye is very delicate and we want to make sure that everything is behaving like it should.
Thanks so much for calling in. And we have Julie on the line. Julie, you're on live with Dr. Foster. What's your question?
I would like to know if you get the ECP treatment, if you can get it if you don't have a cataract, and how does it affect you having to take glaucoma drops?
What was the second part?
How does it affect you as far as glaucoma drops? Will it eliminate the need for those?
Oh, great question. So the ECP is not typically done without cataract surgery, just because there are other lasers that we can do, like SLT, for instance. So in general, if a patient does not have the need for any other intraocular surgery, then we would do something like laser, not go in the eye with the ECP. So that's my general rule of thumb there. As far as the drops, the goal for a lot of these procedures is to reduce the need or eliminate the need for eye drops. In the FDA trials with the Ice Stent in particular, about 70% of patients were off of eye drops 1 year after the surgery. So that's really good, compelling data to me that a lot of my patients I'll be able to get off drops. But typically I'm very conservative, so often early on I keep you on drops, and I essentially until we're off all of the other medications after the cataract surgery, because I want to make sure that everything's behaving before I just say stop the drops altogether. But that's really great data long term from the FDA, so I'm excited about that.
Thanks so much for calling in. And Julie, now we have Kathy on the line. Kathy, you're live in the studio with Dr. Foster. What's your question?
Yes, I'd like to know if you can get the Ice Stent even if you don't have a cataract.
So similar to the ECP laser, the Ice Stent is actually just approved for patients that have a cataract. And it's the same rationale that you're going into the eye to do a cataract. It's a good time to do any other work while you're in there, but it's actually not FDA approved at this point for procedures by itself without a cataract. So it doesn't mean you're out of luck. That we have other procedures like, for instance, SLT, that it's very safe and effective in patients that don't have a cataract. So that's a great question, though.
Thanks so much for calling in. And if you have a question, the number is 361-4675. 361-4675. So Dennis, can you tell us from a patient perspective, what was your surgical experience like?
I don't remember much of it. So it was great. No, it was good. The prep time was easy, and they explained what they was going to do. And then once I was given the IV and put me out a little bit, everything was fine after that. And I thought it was very quick. I was surprised how fast it was. And I was up out of there and out and had a little scratchiness, but within a day that was gone, and didn't realize you had so much done, because Dr. Foster did so much in my eyes at one time that I was amazed that afterwards I didn't feel anything to speak of. It was easy. And so I wasn't, he did one eye, then waited, 2 weeks, was it? And we did the other eye, and I wasn't nervous going back in the second time, because the first time was so good that the second time I was comfortable with it, It turned out great. I mean, I feel so much relaxed now that I don't have to worry about taking those drops or missing them. I didn't mind taking them, but it was a pain, but to miss one scared me. Now that worry's gone, and it makes my life more easy, easier. I don't let that stress there.
How nice. It's good for me to know as I get older.
Yeah.
I think that's very comforting.
Yeah, we have enough stress in our life without
Yes,
having to worry
we
about
do.
this.
Yes, we do. Well, we have John on the phone. John, you're in live with the studio with Dr. Foster. What's your question?
Well, I have a question about a family member who has macular degeneration, and we were curious if there's any other type of ease treatment for that other than the drops and that type of thing.
So for macular degeneration, there's two forms. There's dry and there's wet. The wet form, the treatment for wet has essentially revolutionized over the past 10 years with the invention of, they're called anti-VEGF medication. And those are injected into the eye, and they've essentially changed the whole outlook of patients with wet macular degeneration and preserving vision and sometimes even improving vision in most patients. With dry, the mainstay of treatment is AREDS, vitamins, and that's what's proven to work for dry. Macular degeneration is very interesting because down the road we're going to see even interesting things like gene therapy, doing essentially viral vectors where they're actually delivering genes into the retina. And there's some really high-tech stuff coming down the road that I'm really excited about, because it's such a common disease that if we can develop some new treatments for particularly dry and better treatments for wet, it's going to change thousands and thousands and even millions of lives.
Wonderful.
Yeah.
Thank you so much for calling in. And I know that you have a website for people to look up this kinds of information. It's sightforlife.com.
Definitely.
Okay, sightforlife.com. And the phone number is 866-865-2020. So if you're interested in finding out more from the Eye Associates, you can go online or call the phone number, and tell us where all the offices are located at.
Yeah, so we have actually 5 offices: Sarasota, East and West Bradenton, Ellenton, and Sun City. And you can see me on the highway too.
Yes, I'm sure you must do a lot of driving. And so, Dennis, I know you must be very glad that you did this surgery.
I certainly am, yes.
And how did you pick Dr. Foster?
Well, I was going to have it done up north, where my main doctor was, but then I've talked to so many people around here, and they said, well, a lot of people are my age, and so there's a lot of this surgery going on. And they mentioned Dr. Foster. He's a really nice personality, he's easygoing, and he kind of matches yours. So, you know, they said they've had a lot of good reports on him. So I said, sounds like my kind of guy.
And he
So-
was.
And he was. And I'm super satisfied with what he's done and very comfortable with it. So I would recommend him to anybody.
Isn't
Thank
that
you.
He did a
great?
good job.
He is. He's a very nice guy.
Yes.
So Dr. Foster, why is this new technology so beneficial to glaucoma patients? And also, what is the prep for that surgery? I know it was easy once you got that IV going,
Yeah.
but
Yeah.
is there prep for that?
The only preparation is a visit to see us where we do a comprehensive eye exam and we determine what we need to do. And then an eye drop a day before the surgery and the day of the surgery. And then there's a lot of drops afterward to heal from a cataract. And then just a few follow-up visits. Typically we'll do two post-operative visits. But what I love about my field and what I love about this new technology is that we're getting better and better, improving our patients' quality of life, and that includes reducing, need for eye drops, assuaging fear about missing a drop, and Dennis described that beautifully, and also improving vision and just making patients less dependent on glasses, less dependent on eye drops, and we can do it all. Fortunately, in a very short period of time, and it's very safe. So it's a wonderful time to be doing this, and I feel really privileged to be able to.
Isn't that wonderful? We have one caller on the line, Crystal. We only have like a
Okay,
minute left.
sure.
So Crystal, you're on the air live with Dr. Foster. What's your question?
How do I know if I have glaucoma?
The only way to know if you have glaucoma is to have an eye exam, and it would involve an examination of the optic nerve combined with a pressure check. And pretty much any optometrist or ophthalmologist you see will look at the pressure, and often they're doing an examination of the optic nerve as well. But what I encourage all my patients or anyone listening to do is just ask, especially if you have a family history, mention that to the doctor and say, hey, I have a family history, I'm concerned about glaucoma, what do you think? And they can give you their honest opinion on whether or not they think you have it. If there's a concern that you do, often I get referrals for glaucoma evaluations from outside eye doctors to essentially get a second opinion or consider treatment like laser or even the Ice Stent or ECP. So that's really the first step, is to get your eyes checked, because as we said, it's painless, and a lot of times you wouldn't even know you had it just by using your eyes.
Thank you so much for calling in, and thank you both for being here, Dr.
Thank you so
Foster. It was a
much.
pleasure to
Yep.
see you. And I'm so glad you're doing so
Yep.
well.
I am
Dennis.
doing
How
great.
terrific.
Yeah, I feel
Yep.
much,
for coming
I'm
out.
very relieved.
Good.
And we'll see you next time on Local Doctors On Call.